We are moving through our general pathology section. We are going to now discuss developmental, hereditary, and congenital disorders. Okay, so first off, we have our trisomy 21. Okay, so this is going to be Down syndrome or Down syndrome. So make sure you're familiar with this. You want to be able to identify it and act accordingly when you have a patient, know how to treat them, okay? Understand what might be problematic for them in the oral cavity. Now, trisomy 21 is a chromosomal disorder in which there is either one complete or one partial extra copy of chromosome 21. Now, incidence increases with the age of the mother. Clinical characteristics, so varying degrees of mild to severe mental impairment, which progresses as the individual ages. Okay, you'll also see signs